I think it started out like this, but gradually the 31 to 40 age group are getting more and more affected, and similarly 11 to 20-year age group are also affected. And when you look at this data for the 4 months last year, you see the male population that's more heavily affected than the female population in blue. And at that time, a lot of our cases were cross-border cases coming from India. They were fleeing the rise in cases in India and coming to Nepal. So mostly, men were affected and females, very small number. But when you go back to this now, see, the females are affected much more now than before. Now, this is the, again, the total, in totality, total recovered, total active cases. We have a large group of active cases right now, that's in dark blue. And deaths, now death rate has climbed up. If you remember last year, death rate was 0.6%, when in the Western countries, death rate was close to 2%. We had a death rate of 0.6%. So we were very smug in the fact that, we are doing much better than the Western countries. But now the death rate is starting to climb up. It's at 0.96% now. Now the virus, I'm sure you've seen a lot of photos, with the spikes sticking out. This represents the SARS-CoV-2 virus that causes COVID-19, and inside is the single-stranded RNA, and this outer coating, of course, is got the membrane. It has a lot of proteins. Membrane protein, nucleocapsid protein, envelope protein. So it has all different kinds of protein, but the most important protein is the spike protein, the spikes coming out of this virus. And a lot of the vaccines that are produced now, they make antibodies against the spike protein and neutralize the virus. So just to remember that the RNA, that's the genetic material of the virus, is inside, and then the spike protein is on the outside, and the vaccines produce antibodies that bind to the spike protein and neutralize the virus. So what is a variant of SARS-CoV-2? So, we have the virus there with the single-stranded RNA inside, and the viruses evolve over time. They're very smart. They're very smart. They're much smarter than us. And when a virus enters a cell, inside a human, then they make copies of themselves. That process is called replication. So they make copies of themselves and they multiply at great numbers. And when they multiply and make copies, there might be a slight change in the virus, in the genetic material. And the genetic material of the virus is the RNA. And this is called a mutation. So if there is a change, little change in the virus, it's called a mutation. And a virus with one or more mutations is called a variant. So that means it behaves a little differently. Variant means behaving a little bit differently. And some variants don't cause any problems, but other variants cause problem in that they may cause the disease to be more severe, and they may cause the disease to be more transmissible. That means, a person can spread to many more people now. And some variants also cause the vaccine to not work very effectively. So these are very smart things that are causing a lot of problems. Now, Ashok also asked me to tell me, he said, can you please explain what genetic material changes? But that's a very difficult thing for me to answer. If you look at this graph, the genome sequence of COVID is so complex. There are, so I won't be able to tell you, where the mutation is. It's very, very complex. They have lots of different A, B, C, D, and they have all numbers, and they find mutation in different areas, and that's why, they have the numbers that they're giving the mutant strains or the variants. So the common variants are, what you have been hearing, the UK variant, the South Africa variant, and the Brazil variant. So the UK variant, also called the B117 variant, was first detected in September 2020, and it has spread already to lots of places in Europe, the US, and has come to India, and also and also has been found in Nepal among travelers who came from the UK. But recently, genome sequencing has not been done in Nepal to find out whether the variants, which types of variants these are, but they were tested. Genome sequencing was done a few months back by sending samples to Hong Kong, for the test, and then we heard that the UK variant had come to Nepal. Now, this other variant that is of concern is South African variant. And South African variant, besides being more severe and causing more transmissible disease, it also makes the vaccine not work, particularly the AstraZeneca vaccine. And, when South Africa had imported a lot of AstraZeneca vaccine to immunize their citizens, they found that the mutant strain or the variant they had, B1351, was not working. The vaccine was not working against this variant, so they stopped immunization. So that is where the variants become very important. And there is the Brazilian variant, which is a P1 variant, first detected in December 2020. And it also causes increased transmission, increased severity, and also that reduction of vaccine effectiveness. Now, there is the Indian variant called B1617 now. Now, we already talked, the variants caused increased transmission, more people get affected, and there is more severe disease and diminished response to vaccines. And it seems to affect the younger age group, but that is not really said. Why it affects the younger people, 21 to 40 age group, is because, again, that's the mobile population. That's the population that goes to school, colleges, eats out, and goes to movies and goes on travel. So because of that, the younger population are much more affected right now. Now, how does COVID transmit? Before we talk about how can we prevent, you have to know how it is transmitted. The main mode of transmission is what's called a droplet transmission. So droplet transmission, if you look at the picture on the right side, a person coughs or sneezes, a lot of the water particles are released, from your nose and mouth, and they can go and sit on another person, or it can fall to the ground, it can land on the table. And then if the person happens to touch the nose and the mouth, can get it on the fingers, then you can get it on your computer, laptop, you can get it on doorknobs, you can get it on the telephone, you really can get it everywhere. That's the droplet, and it spreads through droplet transmission. Now, there's a lot of talk about airborne transmission. This gets talked about when there are high rates of transmission. It got talked about when we had the cruise ships, Diamond Princess cruise ship, COVID. If you remember, people talked about airborne transmission, like people staying in different rooms and not in contact with people with COVID also got the disease. And then it got talked about when they had big outbreaks in the US, and, they had super spreading events, like one persons eating in restaurants, they were far apart, but the air conditioner blew the air right into, from the infected person to people at other tables far away, and those people got the disease. So we got talked about airborne transmission, but later on, I think the CDC and the WHO both said, no, it's mainly droplet transmission and there's no airborne transmission. But now they are coming to realize that there is airborne transmission. They are finally acknowledging that there is airborne transmission. That means, so small particles, less than 5 microns, these small particles, they get suspended in the air and they fly further, with the air current or wind speed or whatever. Now, if you look at the human hair, it has a diameter of 60 to 120 micron, and then the droplets, that water vapor that we sneeze and cough out, that's more than 5 microns. So the hair is 12 to 24 times more thicker than the droplet, and then this is the airborne transmission. The tiny particles are even less smaller than the droplet. So you can see these small things that we may not even see settle on different surfaces or get carried to people that are far apart. So this airborne transmission makes it very, very scary. But wearing a mask will prevent airborne transmission too. So how can I prevent COVID-19? So controlling is, one is all these things that a person can do. And the next one is really immunization. So the thing that we do, this gets talked about, with every telephone call, you've got to listen to this message. So the physical distancing, now we say 2 meters, not 1 meter really. Wearing a mask, avoid crowds, especially avoid meeting people, especially indoors. Like indoors, the air doesn't circulate and the virus can sit there for a long time. So meeting with people, even 1 or 2 people, try to do it indoors. Washing hands regularly with soap and water will get rid of the virus from your hands, and avoid touching your nose and mouth. And if you have to cough or sneeze, you do it into tissues or your elbow, and then keep surfaces clean, like tabletops, computers, laptops, your phones, your doorknobs, the ones that are surfaces that are touched frequently, keep them clean, and stay at home if you don't have to go out. Now, of course, Kathmandu is in a lockdown mode and we have to stay at home, but there is still a big crowd outside that I see. I'm able to drive around because I work in a hospital. So when I drive around morning and afternoon, I see a lot of people still on the street. So the lockdown is not really that strict now. And wearing a mask, what kind of mask you wear. I have to take this call. I have a very sick patient. Hello, guys. I'm busy. Tell me quickly. Hello. Hazur. She died. Okay, sorry, the mother. Tell me quickly. I'm in the middle of a talk. In the meantime. Can you decide, talk to the doctors and decide? I'm busy too. Dr. Shanta and yes, thank you. Sorry, one of my COVID patients died. It's very sad. Okay, so double masking. So double masking is better than single mask. That's what the experts are saying. Double masking can be with a surgical mask inside and a cotton mask on the outside. Now, N95 mask, they are in the proper N95, not this one that Karina Kapoor is wearing, but a proper N95 is to be used by the healthcare workers, and we are running into shortages of supplies already. So I would advise people not to buy a proper N95 because that's really for the healthcare workers. So this kind of N95 is okay, or a double mask, surgical mask and a cloth mask over it. It gives you a good fit. It's very good. I do that most of the time myself. And then, of course, wearing a mask under the nose or under the chin is useless. So this is very important. Now, besides the personal things that you can do or you should do, the next is really COVID vaccines is what we are lacking right now. So again, you look at the structure of the virus, the RNA is outside, the spike protein on the outside, and all vaccine candidates produce antibodies against the spike protein. So what they do is, antibody means, antibody combines with the antigen. Antigen is protein. So the antibody combines with the protein or the antigen, and then it neutralizes the virus. That's what it is. So all vaccine candidates produce antibodies against the spike protein, and all vaccines are not equally effective, but they have been found to cause protection against severe disease and deaths or hospitalization. So, and I want to talk to you a little bit about natural immunity. What happens after you get the disease? Natural infection, whether you have had symptoms or not. Ashok sir had no symptoms and I had some symptoms. So natural infection, with or without symptoms, it generates antibodies, that neutralize the virus if you should come in contact with the virus. So there are two kinds of immunity. One is called cellular immunity, one is humoral immunity. Humoral immunity is the antibody production, and the cellular immunity is it stimulates our cells, the cells we have inside our body, to fight against the disease. So that cellular immunity is also very important. So natural infection gives you both. It generates antibodies and it also gives cellular immunity. So we have a two-pronged approach to fight disease. And when does antibody get produced? It gets produced from 5 to 7 days after infection and peaks in about a month. And that's why, when people need to get vaccines, you have to wait for 1 month at least before you get the vaccine. And in the beginning, people said the antibodies may last only for 3 months. Now it is suggested that the antibodies last longer, 6 to 8 weeks. And as we go into more into this COVID situation and more research will come out, then we will know whether natural immunity lasts for a long, long time. We won't know that for a while. And reinfections can occur. You may have had infection, but we know of people who get a second infection too. But these are very few that have been recorded, but it can occur. Now, the COVID vaccines, there are, of course, different types of vaccine. I'm sure you've heard about the mRNA vaccines, the new technology. They have to be refrigerated in very, very cold temperatures. -80, one is -80, one is up to -25, so not suitable for us. And they have protection up to 95%, but they're not that effective against the UK variant, we are finding out. Now, the viral vector vaccine, that's the Oxford AstraZeneca, which is now produced by the Serum Institute of India, Covishield, which came to Nepal, was gifted by India first, then Nepal bought 10 lakh doses, and another 10 lakhs is still pending. And all the healthcare workers got immunized, and people over 65, and then people in the banks, people in the the diplomats, and everyone got it. But we have not able to give second doses to a lot of the folks. We have not been able to immunize the under 60s, and it's really a sad thing. I know Sputnik is the Russian vaccine, supposed to be effective about 85%. That has not. I don't know that has come to Nepal yet. And Sinopharm has come to Nepal. The inactivated virus vaccine, Sinopharm, made in China, that has come to Nepal. That was given to under 59 years of age. But again, people have just received 1 dose. They have not received a second dose. Now, even after 1 dose, there is some protection against severe disease and hospitalization. But of course, 2 doses are ideal. And then after 2 doses, you have to wait for 2 weeks to get good protection. So Oxford AstraZeneca, or the Covishield vaccine that had come to Nepal, it's supposed to have protection for up to 67% only, but it does protect 100% against severe disease, hospitalization, and death. So it's really a good thing to get, if you are able to get hold of vaccines. I know all teachers should get vaccine, all students should get vaccine, but I don't know when we'll get there. So people who've already had the virus, do they still need to be vaccinated? Yes. Right now, the thinking is yes, because natural immunity can decline over time, and it gets strengthened with vaccination. So, we have this person with a natural immunity that has fewer antibodies, but after the vaccine, the antibody levels rise and you have better protection. So you need to be immunized even if you've had the disease. And if people are immunized, should they still wear a mask? Yes, right now, yes, because if you come in contact with an infected person, you may have the virus sitting in your nose. You may not get sick, but the virus sits in your nose, and you could really give it to another person during coughing and sneezing. So you should really wear a mask. Right now, we need to have people wear a mask because our immunization rates are very low right now. So how do we protect ourselves? Now, short of vaccination, we really, we don't have a lot of tools. So we need to have a high index of suspicion at all times. The person who brings the disease could be someone very close to you. So always wear a mask. I made the mistake about 1.5 months ago to go on a trip outside of Kathmandu with my relatives who never leave their house, who I thought never left their house. And when I came back, I had a fever and a headache, and I felt like I had COVID. And I was trying to find out who gave it to me, and then realized that the person who traveled with me to Hetona, that person had the disease, but she felt like she had a urine infection and was taking antibiotics and not really telling us that she had a fever. So So she was someone very close who never left the house, and we thought we were protected, So so you have to think, if this person sitting next to me, it could be your family member, it could be your brother, sister, husband, wife, that they could really give the disease. So always wear a mask. Avoid crowds. And right now, of course, we have the lockdown, but people are still getting married. So I think the weddings you can always go to. So I would suggest, avoid going to weddings that are still being held now. Avoid meeting with people indoors. If you have to meet them now, the weather is good. There's not that much rain, so you can meet with not too many people, one or two people, meet with people outdoors, and then make sure you stay 6 feet apart. Look out for early signs. A lot of my relatives say I had a fever, maybe up to 99 or 99.5. And they say, well, I had very low grade fever. I'll wait a day to see. It may not be anything. It may go away. But that could be the warning sign. That could be the first sign that you have COVID. So low grade fever, you have to take seriously. Sometimes, with sore throat, sometimes some headache, body aches, anything that's unusual, that you feel is unusual for you, you got to watch out for COVID. And unusually tired, my sister-in-law, Ashok's sister, who had come to visit us from the US, she had 2 shots of Pfizer vaccine, and she thought she was very well protected. And then she went back to the US on a flight, had a negative PCR. But when she went back to the US, she said, I'm so tired. I don't think it's just the jet lag. I think I have COVID. And she got a PCR test and she turned positive. So unusual amount of fatigue. Also, you have to think, is it COVID? You may have slight runny nose, slight cough and cold. May not, normally you wouldn't think twice about it, but around now, you have to think. And sometimes people present with diarrhea. So if someone has diarrhea and fever, you got to think, is this COVID? So just, again, have a low index of suspicion. And what do? You isolate at the earliest before even getting tested. You got to stay separate from others so you don't give the disease to everyone. And, when I came back from Hetona 6 weeks ago, and I had a slight fever and a headache, I isolated myself. So no one else got the disease at that time, but this time was different. We had 5 people in our house get the disease. So isolate at the earliest before getting tested. Get tested. Some people postpone. They say, well, I'm going to wait and see if this thing goes away, and I'll get tested if it's positive. If you can stay isolated for 1 week to 10 days, you don't have to get tested. But if you're not willing to do that, if you're going to mix with people, then you have to get tested. And then if you are positive, then contact tracing, find out in your family members, who all have come in contact with you. And then you got to test them all. All people have to stay in quarantine. Quarantine period is for 2 weeks. In Nepal, no one does that. People don't quarantine for 2 weeks. People usually quarantine for 7 days. Now, most of the time, the quarantine period of 14 days is you catch the outliers. And most of it is really within a week. Most infections, if you have to take middle number, it's day 5. Okay, a lot of people, after they come in contact with a COVID positive patient, by day 5 they will get the disease. And but within 7 days is what most people are doing here. But ideal is 2 weeks, the quarantine, because some people can still develop the disease after 7 days up to 2 weeks. So if you're not going to get tested, then you have to stay isolated. And you can infect others from 2 days before symptoms. That's called the pre-symptomatic phase. This is why this disease is so difficult to control. When you don't have the symptoms, you feel normal, you can still give it to others 2 days before symptoms. So if I get sick today, I know that if the people who came in contact with me yesterday and the day before are likely to get the disease. That's how you have to think, okay? So your contact tracing will be the ones that you came in contact with, before you had symptoms for 2 days, and then after you had symptoms, for whatever number of days. So this is the pre-symptomatic. This is what has made the disease very difficult to control, not knowing that you have it and you can still give it to others. So some people will never get any symptoms, like Ashok sir. I think one of the reasons we had 5 people infected in the house is because he never had any symptoms. And his sister was flying out on a plane, and he never had any symptoms throughout. So if he had any symptoms, maybe so many people in our house would not have been affected. So some will never get symptoms, that's asymptomatic, but they can still transmit to others. So this is why the difficult is difficult to control, because they have asymptomatic persons who can infect others and pre-symptomatic persons who can infect others, okay? So it's a bit tricky. And I would like people to be very clear about this. So if you're not very clear about this, please, we do questions at the end. Now, home isolation guidelines. What do? You have COVID, or you need to isolate yourself. You don't know that you have COVID. You have symptoms, and you want to isolate yourself. So preferably a single room with attached bathroom. That is the best. But not everyone will have access to attached bathroom. And it should be, the room preferably should be well ventilated and well lit. And if bathroom is to be shared, clean with Lysol or clean with chlorine. You can do bleach, 1 part water, 1 part bleach, 5 parts water. You can do that, and before others visit. So you use the bathroom, and then you just, you make the chlorine solution in a bucket, and with a mug, you just disinfect everything. You can do that, the taps that you use, the commode or the toilet seat, or just the area that you use, just clean everything. With chlorine. Chlorine is really the best before others visit. And then you keep a set of utensils for your use, and you wash it yourself, and then you put it out for others to put food in that. Sometimes people use disposable utensils, like in our hospital, we use disposable utensils because our kitchen staff didn't want the utensils back, and the patients are not, should not be cleaning their utensils. I mean, they're too sick in the hospital on oxygen, so they don't clean utensils. So we are using dispensable utensils. But for the hospital setting, that is okay. But for home, keep a set of utensils, wash it yourself, and then just keep it out, for others to put food into it. And then when they put the food into it, you take it inside and you eat it. And exercise in your space. You may just have one room, but you should exercise as much as you can in your room. You read, if you have a TV, you watch TV or use your phone. And it's a very, very lonely disease because you cannot meet others. When I was isolating, I wouldn't come in contact with anyone. And it's a very, very scary feeling. And very scary, very lonely. I mean, even at home, it's lonely. Forget the hospital. No one will look at you. They are wearing this personal protective equipment, and most of the time, all the talking is done on the phone with the patient in our hospital. I'm sure that's the case everywhere. They call you on the phone. Can you tell me how you are feeling today? And are you eating? Are you going to the toilet? Are you in pain? And things like that they do on the phone. And everything, a lot of the talking gets done on the phone, and then they will briefly go in to see the patient because in the hospital, because they want to minimize the contact time with the patient. Okay, so it's a very extremely lonely disease. People have a lot of stress, and you cannot visit, you cannot see your family members if they're hospitalized, and if they're dying, you cannot see them. It's a very, very sad disease. And the home isolation guidelines is on the also on the WHO website and on the CVEC Clinic website too. If you just Google CVEC Clinic, it'll take you there, and I have it on the slide, the home isolation guidelines. It's in great detail, but this one is just, concise, that you take away points will be simple with this. And I mean, this slide didn't come out as well. It's COVID disease progression. Sorry, just give me a second. Yeah, giving a talk. Okay. And so what happens, I wanted to tell a little bit about the disease, and this turned out to be a good diagram, but it didn't come out all that well. So in the first week, it's called the viremic phase. Okay, this is when people have fever, headache, cough, runny nose, sneezing, scratching, diarrhea, all that they have in the beginning. And this stage usually lasts for 1 week. Okay, and in this phase, a lot of the people, they can just stay in home isolation. They don't have to go anywhere, and they are supposed to monitor the oxygen with a small oximeter machine that costs about 3,000 rupees. You can even order it online, and if you are able to do that, you stay home. But of course, people with older people, people with health-related complications, diabetes, heart disease. Obesity is a severe risk factor. It's really the highest on the list. Obesity is higher risk than diabetes, heart disease, and hypertension, everything. Okay. So, so if people have a lot of risk factors for severe disease, older people, then they might need to be hospitalized, but others can just stay isolated. 80% of people will get better with that. They don't need to visit the hospital. They don't need to do anything. Okay. They may stay in touch with a provider, with a doctor or nurse and report their symptoms, but they can stay at home and then get well. Okay. That's the viremic phase. Now, if someone's oxygen goes down in this stage and people have to be in the hospital, this is when the antiviral like remdesivir will work, because it's the first stage is the stage of viral multiplication. The virus multiplies in the cells, and you can control that to some extent with the antiviral drug remdesivir. It doesn't work in the other stages. After 1 week, it really usually doesn't work. So the best money you can get out of is by using it in the first week or the viremic phase of the disease. Then the next phase, 80% of people who get better, then they, will get well, and they really would not progress to the next phase, which is the pulmonary phase, when they will have symptoms, like cough, shortness of breath, and they might have a COVID pneumonia. And in this phase also, what starts is called the host inflammatory response, or what the doctors or the medical people call it the cytokine storm. The body releases different chemicals, and interleukin-6 and others, different chemicals that cause flooding of tissues with fluid. Like, the lungs get flooded with fluids, and your lungs that normally contain air now contain fluid. And one has difficulty breathing, needing oxygen, and higher amounts of oxygen, maybe mechanical ventilation. So that can happen in this pulmonary phase. And this is when, people are mostly in the hospital, and this can really go on for several weeks, really, in the severe phase, when the virus is gone from the system, but then the effect on the lungs are carrying on, and also it could affect the heart, the kidneys, the liver, and a host of other organs. Right. So in the viremic phase, the antiviral remdesivir would work. In the other phases, we use a drug called steroids, dexamethasone, or prednisone. Most of the time we use dexamethasone. It's a strong steroid medication. It sort of blunts that response. Okay, it helps to resolve the fluid leak. That's what the dexamethasone does, and it has been known to reduce mortality. It has a mortality benefit. This is the only drug that has been proven to have a mortality benefit, in that less people die if they take this drug. So dexamethasone is a very cheap drug. It's not expensive, unlike remdesivir, which is very expensive and in short supply. So the dexamethasone is 6 milligrams a day for 10 days. And COVID also causes blockage in the arteries. It can cause blockage in the arteries and veins, causing clots in the lungs, clots in your blood vessels in places. And so the patients who are admitted in this pulmonary phase and the severe phase, they also receive anticoagulant prophylactics. Some people will receive a bigger dose, treatment dose. Some people will receive a prevention dose, a smaller dose, like 40 milligram, something like that. So those are the things that we do in the hospital. We give someone oxygen, via a cannula, a mask, or sometimes, high flow nasal cannula or a ventilator. And then people also get these other drugs to help them get out of the severe phase. So there is a disaster situation in Kathmandu and other areas right now. I think everyone lives in this community, so I think we all know. We get calls all day for hospital beds, and all the hospitals are getting calls for hospital beds, ICU beds, ventilator beds, and then people are turned away. Ambulances are not taking people now because they know that they are not able to take the patient to a hospital. The hospital will say, we have no beds, you take the patient away. So people are dying at home, dying on the streets, and it's a very dire situation. There's lack of oxygen. Very soon, there's going to be lack of oxygen, and we are getting there. In a day or two, we'll get there. Lack of oxygen, lack of medications like remdesivir, and lack of nursing manpower. Nurses are the ones that spend the most time with the patient, and they're the ones donning their PPE for 6 to 8 hours a day and taking care of the patient. And the PPE is, you are inside this plastic suit with goggles, N95 mask, and then it's just it's very difficult to stay like that, and they are not able to drink water, they're not able to go to the toilet while they have this PPE on, because you'll have to get out of it and then get into it. So it's an extreme stress on the nursing manpower. And then what we see here is the government is busy with power struggle, this vote of no confidence, this and that. It just doesn't make sense in this humanitarian crisis. And so the only thing we can do right now, we are not getting help from the government. The people are not getting help from the government. So the only thing we can do is to protect ourselves and our loved ones by preventing disease, all the things that we talked about, and also immunizing when possible. And that's not possible right now. But there are activist groups now, the change.org and places like that. They're doing petitions, to bring vaccines to Nepal. They're urging the US government and others. And also we need to say to our folks, whoever, you can really start a group, and we need to be active in saying that, well, make a tent city with oxygen, open up the Bir Hospital surgical wing that has 1,000 beds with oxygen, things like that. I think we all need to do that. We cannot lie low and expect the government to take charge, because the government is not doing it right now, and it's really a disaster situation. I'm sorry to be so negative, but the news is negative. And, there's a lot of, and we have a lot of foreign tourists now that are stranded on the mountains, and some are waiting to climb Everest, and that has hit news media in a big way. Disaster on Everest, or COVID on Everest. I get calls all day about COVID on Everest, but really, the climbers go there with a risk of death anyway. So they know that already, and they are sitting there. They're trying to have a good weather, so they would summit on that day. I think it's planned for next week. But then we have this entire population, that doesn't have a place to go to, when they're sick and need a hospital bed with oxygen. So I would like you people to really take the lead in this. Young people need to do this. And thank you. This is where I work, and we have one of our floors is a COVID floor, and we have 7-8 patients, but it's very, very difficult still. It's very challenging in every way, to take care of COVID patients. And I just heard the sad news that one of my patients died. It's very, very sad. So ending with the somber note, I'm sorry to sound so negative, but the situation is negative right now, and we need to act. Okay, thank you so much for giving me this opportunity, and maybe we can take questions. I will stop sharing. In the slideshow, just exit. Okay. All right. I will negative. Yeah.
So students, do you have any questions?
Let's see, chat.
Prativaji, one of the students had texted me a message asking some questions. May I ask those questions?
Yeah, please.
One of the questions asked if both her grandparents have COVID, can they be isolated in the same room?
Yes, they can be isolated in the same room. Yes.
All right. The other question was, I think you've already answered it during the presentation, but just to reconfirm, if somebody gets COVID after the first dose of vaccination, how long should they wait before they get the second dose of vaccination?
1 month. They wait 1 month. Yeah.
All right. Now, there was another question. I think I'm asking a lot of questions, but I'm sure it'll trigger other questions as well. One of the students was asking if, as you mentioned, 2 meters away, and that may not be possible, especially during when they're climbing elevators or lifts, etc. So in that case, will turning away from the other person who is using a lift work, or should they wait for the next lift? What should they do?
Okay, usually what they do is, people in the same group get in the elevator at the same time. Like if it's you or your family member, close family member, then you get into the lift. If it's someone else that you don't know, I think wait. Right now, the situation is really. Ashok, please don't talk on the phone. So, you know, you wait. You might wait a few minutes, but you wait and get on the lift the next time, because right now it's when there's high level of transmission, it's really airborne. I feel like it's just in the air now. We've had some relatives who are just so isolated in their home, no one ever comes to visit them, and that one is tested positive. So really airborne transmission, I think, is happening right now. Yeah, so we have to be very, very careful during this time.
Thank you.
Hello, ma'am.
Thank you, Prativa ji. Any other questions?
Hello.
Hello, Azur.
Ma'am, there is a rumor that a person with no chronic diseases will not die from COVID. Is it true?
No, that is not true at all. We've had many deaths. They've had deaths in young people, few deaths in young children as well. But people, right now, the thing is, people in the mid life are dying. Not so much the older people. A lot of folks in their 40s and 50s and 60s are getting very sick right now. So that is not true at all. That if you get COVID, that you will come out fine. That is really not true. And then that 10 days of isolation is really tough. So I would suggest, that we'll try to avoid it at all costs. And then hopefully we'll get the vaccine sometime soon.
One of the dangers that a student outlined was standing in the line for the vaccine without the 2-meter distance.
I know.
And actually, she mentioned that somebody got a positive 2 days after getting the vaccine. So what could have been the reason for it? Was it that she got it during the line? How many minutes does one have to be in close contact with somebody who could be asymptomatic to get infected?
Well, it's, remember the 15-minute rule, like if you're in contact with someone for more than 15 minutes. So what now they say is it doesn't have to be 15 minutes at one go. It could be like in a 24-hour period, 1 minute meetings times 15 could also give you the disease. That's what is said now. So 15 minutes is, even small meetings, few minute meetings could really give this to you. I would like to just look at some of the questions here. So vaccinated people, COVID is not going to get over. What they predict right now, I just heard that they believe that the peak will be in 3 weeks. And that is really scary. I think we'll probably cross the 10,000 person mark. So COVID is not going to be over soon. Let's see, next question. Evidence suggests that the variants of coronavirus is to be stronger every time. What makes the virus variant stronger? Well, the viruses get very smart and they mutate, and the mutation on different parts of the RNA, the genetic structure, and they get stronger, and that's how they are able to go on. It's their survival of the fittest. I mean, that's what it is. They get stronger each time they come back to us. So yeah, it seems to be that way. They're getting stronger. And good, we have COVID patients in home, and what if they had dry cough and fever at night for more than 1 week? And what is the drug we can give in the severe phase, and can we give earlier? So they've had it for 1 week already, and you have to know what their oxygen saturation is. This little thing is called a pulse oximeter. You can buy it online nowadays. You can pick it up in pharmacies. And if the saturation is below 93% consistently, and then ideally they need to be in the hospital. I mean, they do need to be in the hospital, but hospitals are not even taking people now, saturation over 90%. And if you call the hospital, they say we have no beds. So the other day I was listening to Dr. Anup Subedi on Kantipur TV, and I think he had a very good idea. He said, keep the pulse oximeter and measure. And he said, if the oxygen goes really low, We said give dexamethasone, the steroid that's effective, from the second week onwards. First week is the viral multiplication phase. You don't need the steroid, but the second week onwards, the phase where it affects the lungs and all the fluid leak. In that phase, you can give the steroid called dexamethasone, 6 milligrams. It comes in tablets of 0.5 milligram, and then you have to give 12 tablets a day and look for a hospital. This is just temporizing. You give it, you give oxygen if you have, and then you have to still look for a hospital bed. I mean, you may want to look up on YouTube, interview with Anup Subedi. He's the infectious disease doctor at HANS Hospital. And I thought that was very nice. He at least told people what they could do while they were waiting for a hospital bed. And giving it in the first week is not that great an idea, but from the second week onwards, it would be good. The dexamethasone first week is remdesivir if you can give. But of course, if people start to need oxygen from the end of the first week, if it's been 5 days, people start to need oxygen, you could give the steroid to see if you can stabilize the lung problem. But this is, again, just look up his YouTube video, Anup Subedi, interview with Anup Subedi, Subedee, on Kantipur. That was good. So it's really a very, very tricky situation. I know people have their uncles, aunts, father, mother, and people are sick, and then there's no place to go when they're sick. Anything else that anyone would like me to address that was not talked about?
One question from Santoshi has been, are there any home remedies?
Home remedies, well, they have not been proven. So, things like zinc, vitamin C, calcium, vitamin D, all that, people take that, and also, a lot of ginger, a lot of the turmeric, all that. We have no knowledge, but if people like it, they should take it. These are harmless things, really. So people can take what they want, but they're not proven to have benefits. So I cannot really say that you take it or you don't take it. I know people are taking azithromycin left and right, and one is not a good idea to do that. Any home remedies? Okay, so that's it about the home remedies. And I think Baba Ramdev came out with a home remedy, but then it was taken off the market, I think, because he was doing false propaganda. This is what I remember. Yeah. And if people are having low oxygen, what really helps is proning. Something that's called proning. This is what is done in the hospitals. So you might look up proning also, how to prone. You put pillow under your pelvis, not under your abdomen. Put pillow under your pelvis, under the, you prone is upside down. You have to lie down upside down. Put a pillow under your face or chin, and then put another pillow or 2-3 pillows under your pelvis, and you stay in that state, and people are really able to increase their oxygen levels much higher with the proning. So while people wait at home, proning they can give oxygen if they have, and they can also give the dexamethasone steroids. Okay. Yeah.
I think one of the challenges that people may also be facing is the access to doctors. Yeah. For those who are the elderly who are by themselves and unable to go, would you suggest any online access that they can have, or online doctors that they can access from home on the internet or something like that?
Yeah, there are several groups actually that are active in this area. Patna Hospital has a group, and there is also this Health at Home group. I think they also do that. And my brother, I must tell you the story of my brother. He got COVID, and then his oxygen fell to 84% at home. And I was called at 9:30 at night. I said, look, I don't have any bed at CVEC, so take him to another hospital. And that hospital kindly provided a bed for him. He went there, but he refused to receive any treatment. He didn't like it, and he just didn't want to stay. And he left, I'm sorry, actually, why I got carried away. I forgot your question in the meantime. Could you please, Divtiji, could you please repeat that? Yes.
Sure, Prativa ji. The question was,
Yeah,
are
yeah,
there any online resources or
yeah.
online doctors that they
That's
can,
right. Yeah. So he has children in the US. His daughter and her husband both are doctors. So they organized a nursing group. They said, well, we arranged this, and I'd given him an oxygen concentrator. So he would get oxygen, and they organized nurses to go visit him from time to time to monitor him and to give him medications because, then the healthcare worker would use the proper personal protective equipment, to go visit him to give medication. So they found it online, so it must be available. Nursing, COVID nursing at home in Kathmandu or something like that. I'm sure you'll have an answer.
Okay, thank you so much, Prativa ji. Well, I think there are a couple of questions that are now really coming in.
No, I wouldn't worry about that if two or more COVID patients stay together, especially the people at home. Like we had 5 people at home with COVID. I mean, 2 people could have really stayed together. And in the past at CWEC, we kept just only one patient per room, and there was extreme anxiety. We separated a husband and wife team also, and they were so anxious, so anxious. We had to have counseling sessions done. So later on, we realized that other hospitals were keeping family members in one room and doing fine. You talk about viral load and whether someone's viral load is low and another person can give a higher load. I think it's become a theoretical exercise. So and in our hospital we kept patients in separately first, but now we have to double up because there are no beds. So we are doubling up in each room. So chances of mutation of virus if 2 or more patients stay together. I think the mutation really occurs inside the body. It replicates, it makes copies of itself. It enters the human cell and it makes copies of itself. And while it makes a lot of copies, like 1,000 copies, and then some of the genetic material changes, and then it becomes, there is a mutation, and then 2 or more mutations will cause a variant. So I doubt that, especially if the disease is happening around the same time in the same neighborhood, I think 2 people staying together will not cause a variant to occur. I think the variant in the past, like for flu viruses, we say that the flu viruses also mutate a lot. So the World Health Organization and the CDC in the US, they monitor the flu viruses, the genetic material of the flu viruses. Like there are always, and the flu vaccine always consists of 3 to 4 different strain of viruses. It might have Beijing virus, and then it might have the California virus, and then maybe the one from the UK. So they combine the 3 strains of the circulating virus in the previous year and combine a flu vaccine. Okay. So there is always the fear that from animals you could mutate, like you have the flu virus and you're not immunized, and then, you have animals around, animals can transmit, there's you must have heard of the bird flu. And so the danger with that bird flu is, that bird flu could mutate in a human and produce a more severe variant virus. So something like that, I feel maybe it has to, for mutations to occur, definitely, when it goes to another country, different people, it seems to happen. But I won't worry about mutations by mutation and a variant formation by staying in the same room, in the same community that people are. One Indian doctor has come up with a video where she's mentioned not to take carbohydrate to recover from COVID. This, I don't know about that. I haven't read about that in scientific literature, so I won't worry about that. Now, DAFE Care is also providing doctor consultation. This was probably from Star Hospital, so I think they're doing a lot. Star Hospital, I think, is doing a lot. You can contact. There are several different groups for us to contact. And what can you eat in COVID positive patient? Eat anything that you like. Like when I ate a lot when I had COVID, I just ate a lot. I would have a lot of sweets out, and then you really don't gain weight even if you eat a lot. So you like to eat. Right now, someone who helps me in my house, household help, has COVID, and she wants to eat fried rice and noodles and momos and things like that. She doesn't want to eat dal bhat, which used to be a favorite. So whatever people want to eat, you give, because adequate nutrition is always very important. So anything that you like. Oxford vaccine promotes blood clots. Yes, it was found blood clots and a few deaths in Europe. Yeah, they had, but the rate was, if I remember now, I can't recall it very well, like 0.5 per a million or something like that. It did cause blood clots in the brain and in the abdomen, like in the sinuses, in the venous sinuses of the brain, and in the abdomen, and people who got clots from the AstraZeneca vaccine, there was a few people who got it. There was a 40% risk of death. So then several countries banned it. I know Germany banned it, and a few other countries banned. Canada banned it, but now it's come back that it's not that big a problem. That the disease is. Which is the worst enemy? The disease is the worst enemy, not the clot. So when you look at the public health good, I think it really would be that it would be good to continue with the vaccination program with the AstraZeneca vaccine. I know people worried here too, but we haven't come across, in Nepal, we haven't come across any such bad side effects from the vaccine. And in South Africa, when they had imported the AstraZeneca vaccine, what they found that the South African variant, the vaccine was not effective against the South African variant, so they stopped using it. But the clot problem is not resolved. Rates are low, but the vaccine is good against disease. So we all are still. I felt good enough to take it. I did worry about the clot. If I had a headache, I would think, am I getting a clot in the brain? But what to do? Which is worse? So I think I wouldn't worry about the clot. I would just immunize. Which nutrients help in transferring oxygen in your blood from the lungs to the tissues? The nutrients help in transferring oxygen. I mean, your red cells do that. Oxygen, your blood moves around. The oxygen moves around in the blood by your red cells. And the red cells are really helped by, the vitamin C and things like that. So maybe the vitamin C does have a role. Now this, I don't have very good knowledge, so I won't comment on that.
One of the earlier questions was, what kind of exercises would you suggest besides proning? I mean, proning is one way, and what are the other exercises you could do normally to prevent COVID or during COVID?
Anything that you are used to, I see anything that you are used to, you should do. I wouldn't start anything new, for during COVID. Some people do a lot of breathing exercises. I did a lot of walking. Ashok did a lot of walking, and some people don't do anything. So I think the exercise that you are used to do, if you are used to doing yoga exercises, I think the breathing exercises would definitely help. Could help, the breathing exercises could help. And then just to feel better also, you need to move around. So it could be just one room, that you move around in the room, or you do, you can do a lot of steps inside a room. You can, when you do it, you realize how much you can do in a room. So people should do the things that they really like to do. Let me look at this question. Everyone's talking about this COVID and how severe is this for people watching. All of these, a normal person could feel being in a panic situation. And to mitigate panic situation. Well, right now there is panic situation in Kathmandu. I think there is panic situation in Kathmandu, but of course we have to then take precautions and take reasonable precautions, and then you are empowered. When you have the knowledge, you should be empowered, right? Take reasonable precautions. You have the knowledge, how it's transmitted, what you can do to prevent, and you should feel empowered, and then feel not be in that panic situation. Of course, if you have a family member who is sick, who doesn't have a hospital bed, then that is a panic situation. But even then, I think you have some tools, right? You can contact the nursing visitors, you can contact the doctor group. Hopefully you can get some oxygen. You do proning, you can use the dexamethasone tablets. Look at Anup Sivedi's video. So there are different things that you can do still, okay? Within constraints, and then you be active, activism, pressure on the government to really bring vaccines, to just open up hospital beds or tent beds with oxygen or whatever. I talked to my relative who's in the army, Nepal army. I said, if the government gives up, they give it to the army, as we have seen in everything here in Nepal. I said, you guys are in the army, so what are you doing? Open a tent hospital with oxygen beds. And then he said, well, Viju, we are expecting that the disease will peak in 3 weeks, so we don't want to do it too soon. I said, look, it's late already. It's too late already. When you don't start, you don't know what are the things that can go wrong, right? You got to start, you got to figure out what can go wrong, fix those things, and then you'll be ready in 3 weeks. I said, better start now. So I'm going to nudge him from my part because, I'm too busy doing everything else, and I'm not, I really wouldn't be able to be very active right now in that activism right now. So you guys have to do it. Well, if we don't have any more questions, can we wrap up?
Yeah, there was one final one. I think, how does the variant evolve country-wise, and what was the reason for this?
Country-wise, and what was the reason for this? Well, I don't know how the variants evolve in different countries. It could be that the variant comes out of, well, as I said, it just happened to evolve over there. When they had the UK variant, I mean, this is what I think. When they had the UK variant, they tested in the US and they realized that 30 of their states also had the UK variant. So people travel and the variant travels with the people. So I wouldn't be able to say, I mean, is it because it mixes in animals? I don't know that. I think the variant can just form in the body, as the cells replicate and multiply, the mutation, and then the variant is formed. And then the variants are easily transmissible. So it infects a whole lot of people. As people travel, they take it to different countries, all around the world. So I think that's what it is.
Ma'am.
Ajay.
म्याम यो चाहिँ मैले चाहिँ के लागेको थियो भने यो क्वेसन बन्दाखेरि चाहिँ अब जस्तै रिसर्च भइरहेछ नि भ्याक्सिनहरुमा डिफरेन्ट रिसर्च भइरहेछ त्यो रिसर्चकै कारणले गर्दाखेरि चाहिँ नयाँ भेरिएन्ट आएको हो कि जस्तो लागेर चाहिँ मैले कन्फर्म गर्न चाहिँ सोधेको थिएँ हो कि होइन
रिसर्च गरेर लाइक ल्याबबाट स्पिल गरेको भनेको चाइना जस्तो
नो म्याम जस्तै अब भ्याक्सिनको लागि त अब रिसर्च गर्नु पर्यो नि त सेम भाइरसमै त्यो भाइरससँग बनाउँदै अब नयाँ उसले नै अब त्यस्तो भएको कारण पनि हुन सक्छ जस्तो लागेको हो कि होइन
मलाई त्यो चाहिँ होइन जस्तो लाग्छ you know how the viruses mutate all the time. हाम्रो cold and flu viruses हेर्नु हो भने there are 200 million cold viruses. त्यस्तो धेरै viruses छ हामीसँग हैन गर्दाखेरि त्यो होइन के आफै नै they are very smart things. They are very, very smart. They can mutate within a person. Like उनीहरु यति multiply गर्छ नि, they make thousands and thousands of copies of themselves, and then while they're making copies, some things change a little bit in the RNA genetic material, and then that's a variant. Causes mutation, and 2 or more mutations will cause a variant. So मलाई त्यो भ्याक्सिन गर्दाखेरि ल्याबबाट आएको जस्तो लाग्दैन है भेरिएन्ट चाहिँ
मैम अनि यो भ्याक्सिनमा चाहिँ हाम्रो जस्तै कोरोनासँग हाम्रो आरएनए हुन्छ भने भ्याक्सिनसँग एमआरएनए हुन्छ अरे त्यो एमआरएनए भनेको चाहिँ के हो
त्यो मेसेन्जर आरएनए ले त्यो मेसेज दिन्छ कि अनि स्पाइक प्रोटिन एन्टिबडीज फर्म गर्नलाई उले मेसेज दिन्छ त्यहाँ मेसेन्जर आरएनए हुन्छ डीएनए हरु हुन्छ हैन ह्युमन बडीमा अनि त्यो मेसेन्जर आरएनए को काम चाहिँ ल अब योलाई स्पाइक प्रोटिन को मेसेज दिने मात्रै हो त्यो मेसेज दिएपछि त्यो सेल भित्र छिर्दैन सो इट गिव्स अ सेन्स अ मेसेज that please make antibodies against the spike protein भनेर उले मेसेन्जर दिएपछि त्यो मेसेन्जर आरएनए निस्किन्छ अनि त्यहाँ स्पाइक प्रोटिन एन्टिबडीज फर्म हुन्छ अब त्यो हजुर
भ्याक्सिनले चाहिँ इन्फर्मेसन दिने काम मात्रै गर्ने हो बडीलाई
हजुर त्यसलाई त्यो एमआरएनए ले हो आई थिंक आई हेभ टु एन्ड नाउ है अशोक आई हेभ टु अटेन्ड टु माइ ड्युटीज है Okay. All right, Aita, thank you so much. I got a chance to interact with you all. Thank you. And feel free to send me any questions. My email is with Bishalji's and Sapela Thatsa email. You can send me an email. I'll be happy to answer.
Sure. Thank you. Thank you so much, Prativa ji. And I think your amazing knowledge, wisdom, clarity, and it's clear that you have ample experience and you have been so helpful for the students. I can see some of them already feeling very reassured, and thank you so much for allowing us to be contacting you via email. I think it's going to be very helpful for the students just to know that they can. So thank you once again, Prativa ji. Sabina ji, do you want to add?
No, like as Pratibha ji is in hurry, thank you very much, Prativa ma'am. So it is our pleasure because this was much required, and today most of the question of our students have been settled down, and then it means a lot to us today. Doctor, like talking to our students, that means a lot. Thank you very much, Pratibha ma'am. In spite of your busy schedule, thank you. Very much.
I take leave now. Thank you.
Right. Okay, students. So like the most required session and then well executed. And I think, yes, we are in the panic situation. The thing is that social media, panic